German media have suggested why in Germany the number of deaths from the new coronavirus is lower than the global average. In Germany, nearly 111,000 officially registered cases of coronavirus infection account for, according to April 9, about 2,200 deaths. Almost as many died in the neighboring Netherlands and Belgium, but the population there is respectively 17 and 11.5 million people, while in Germany, 83 million people, writes Deutsche Welle. In Italy, 140,000 officially infected had about 17,700 deaths, in Spain 152,000, 15,200, in France with 82,000 detected cases of infection, the number of deaths is close to 11,000 cases. In addition, in the United States about 2,000 people began to die per day, about the same as in Germany for the entire time of the epidemic. At the same time, the possibility of understating numbers in Germany is rejected. The country is characterized by an active civil society, strong opposition and the presence of independent media, because, as the publication indicates, such attempts would quickly become public. German media point out three key factors contributing to the relatively low mortality due to coronavirus in Germany: the specifics of the spread of the virus, the level of the German healthcare system and the discipline of the population. Professor Hans-Georg Kreuslich, head of the virology department at the University of Heidelberg Clinic, told the New York Times that the coronavirus in Germany started like an epidemic among skiers. By this, he explained the low average age of those infected in the country. According to the Robert Koch Institute (RKI), which coordinates the fight against the epidemic as a state institution, in the Federal Republic of Germany, the vast majority of patients with COVID-19 (70%) are between 15 and 59 years old, with an average age of 49 years. Thus, the specificity of the spread of the virus in Germany is that at the first stage, before taking radical measures, it was predominantly picked up by young people and middle-aged people, who, as a rule, possess stronger immunity than the elderly. Among them there were many vacationers who became infected in bars and discos in Italian and especially Austrian ski resorts, and then infected people of their circle. Another two large nurseries of coronavirus in Germany were a large carnival party in the Heinsberg region in the west of the country. As a result, 15% of the population were infected there, and a beer festival in the Bavarian town of Mitterteich, and this, as the publication points out, events for which elderly and chronically ill people usually do not go. In Italy, at the early stage, carriers of the virus that were not recognized at that time brought him to hospitals, where many patients soon became victims of a new disease. When, in late March, 72 guests and 17 died of infection in a nursing home in Wolfsburg in Germany, Christian Drosten, director of the Institute of Virology at the Charité Berlin Clinic, regarded this as the beginning of a new phase of the epidemic in the country, which would be accompanied by an increasing number of deaths. This forecast was confirmed on April 9 by RKI. By the end of March, quarantine and a self-isolation regime were already operating in Germany, and the German health care system managed to prepare for the fight against COVID-19. The hospitals freed up extra beds to receive the infected, compiled emergency schedules for doctors and nurses, and, as far as possible, stocked up masks, protective suits and medicines. The Ministry of Health of the Federal Republic of Germany on March 12 ordered 10,000 mechanical ventilation devices (IVL) from the German company Dragerwerk, in addition to the already existing 25,000 machines. Fulfillment of the order is in full swing. For example, the hospitals in Berlin, which had 1,100 devices at the beginning of March, now, according to the Tagesspiegel newspaper, can already provide ventilation for 1,600 patients. By the end of April, this figure should increase to 1,800, by the summer to 2,200. The Minister of Health of the Federal Republic of Germany, Jens Spahn, said on April 9 that currently 10,000 places in intensive care units are available throughout the country. In addition, German clinics accepted almost 200 patients with COVID-19 from France, Italy and the Netherlands for treatment, and according to Der Spiegel, the Bundeswehr, German armed forces, provided 60 British-language mobile ventilation devices to their NATO partner. Also, almost all media publications about the causes of low mortality in Germany from SARS-CoV-2 indicate that in Germany the population is actively tested for the virus. However, tests alone do not save lives. They allow you to identify infected people, but 6 out of 7 cases of COVID-19, Minister Spahn said on April 9, are being treated on an outpatient basis in Germany. Crucial is how strictly infected people comply with quarantine at home. In addition, the Germans listened to German Chancellor Angela Merkel, who on March 18, in her televised address to the nation, urged everyone to minimize social contacts. Many other German politicians constantly addressed the same recommendations to their constituents. All this has contributed to the fact that the number of deaths from coronavirus in Germany so far is much lower than it could be in a pandemic.